Hi there, welcome to Phlebotomy Lecture 3 in Module 1. In this lecture, we're going to talk about safety precautions and infection control as related to blood collection. We're going to define engineering controls, work practice controls, and personal protective equipment, also known as PPE. We're going to talk about healthcare-acquired infections and describe how the chain of infection can occur, including words like pathogen, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. I realize some of the words we're using sound a little lavish, but you need to get used to the laboratory vocabulary. We will help you with that. I should mention too, at any time during these lectures, if you're unclear on a concept or a word, be sure to bring your questions to the lecture/laboratory section. Chances are, if you have a question, someone else does also. So we're going to also talk about the methods utilized to break that chain of infection. So safety precautions. We have to know what we need to do to prevent healthcare acquired infections, HAIs. When we define healthcare acquired infections, that means not just infections that we can get from patients, but also that patients can get from us. So for instance, if you come to work with a cold, chances are you're going to be asked to wear a mask. Every facility has workplace protections in place that lets you know what you need to do if you have open sores, if you have other wounds, if you have cold sores, if you have respiratory infections, if you have a fever, if you have diarrhea. So we want to keep our patients safe as well as keep us safe from our patients. So we do certain things like wear gloves to make sure that we don't get anything that our patients have, and the best thing we can do is hand washing. We'll talk more about that. But healthcare acquired infections, remember, it can go both ways. So the technician can become infected, or we can infect the patient. Or we can leave germs around so other people pick up the infections. So we can get infected from hard surfaces, etc. The Center for Disease Control, CDC, has developed guidelines for controlling healthcare acquired infections. And every facility has their own policies and procedures on how those CDC requirements are implemented. So again, a healthcare associated infection is an infection acquired by a patient as a result of a healthcare procedure. That's the standard definition. So for instance, if someone has surgery and they end up with a surgical wound infection, that's a healthcare acquired infection. They didn't have that infection before they had the procedure. So when we talk about infection control programs, every facility also has infection control programs, which provides oversight and teaches employees how to work safely to prevent infections in ourselves, as well as using the correct protective equipment and procedures so we don't infect the patients. When we talk about the chain of infection, we'll look at a slide that provides a picture of some causes and procedures that we can use to prevent transmission of infection or passing the infection on to others. So each area in this slide can be directly related to a blood collection. When you look at the break the link box, that highlights the most effective way to stop the chain of infection. So look at each blue box, highlights ways to break the chain. At the top we have our infectious agent. Just to the left of that, we have to have a susceptible host. So when we talk about a susceptible host, patients, elderly, newborn, immunocompromised, healthcare workers, those could all be susceptible hosts. So that's why we immunize people. That's why we may have to isolate patients. We're very careful with what happens in the nursery. You can't go up there if you have cold sores. You can't go up there if you have certain illnesses. And we limit the number of people that can go into the nursery. Newborns are very susceptible. And we also talk about healthy lifestyles for healthcare workers. People who exercise and eat right and take care of themselves, chances are they don't get as sick as often, and therefore they can't infect patients as often, and they stay healthier to take care of the patients who are sick. When we talk about immunizations, we talk about a concept called herd immunity. That means if at least 70% of a population is vaccinated against a disease, the chance of the rest of the people getting the disease is very low. So you'll see this a lot as a healthcare worker when flu season comes around. You'll be asked to get your flu shot. In some places, it's mandatory. If the healthcare workers in the facility have their flu shots, even if it's not as effective some years as others, chances are they won't have as many sick workers and they won't get the flu and they can't pass it on to patients that way. You have to have a portal of entry. So germs have to get in somehow through the nose, the mouth, mucous membrane, skin, breaks in skin, or unsterile equipment. So the best thing we can do to prevent infection is good hand hygiene. That includes hand rubs, it includes hand washing. Also the use of standard precautions. So we have certain ways that we handle infectious fluids. We have certain ways that we handle patients through the use of protective personal equipment, and also through, depending on the patient's diagnosis, may include such things as reverse isolation. We also want to make sure that we sterilize equipment properly, and every hospital has policies and procedures dealing with all of these areas. There has to be a means of transmission. So not all pathogens or infectious agents are transmitted the same way. Some may be by droplet, so sneezing, saliva. Some may be airborne. Tuberculosis, if it's in the air, can get in the respiratory tract. Some may be contact. If someone has an infected wound and you touch that wound with a break in your skin, you may get infected that way. Some may be a vector. For instance, ticks are a vector for Lyme disease. And some may be a vehicle. So touching a surface that has been contaminated with a germ that causes diarrhea, and then your hands go to your mouth, you may also get diarrhea that way. So how do we break that again? Look, hand hygiene, standard precautions, protective equipment, possibly patient isolation. The germ also has to have a way to get out. So if you have a nose and a mouth and you're sneezing, boom, the germs are out. Mucous membranes also, and sample collection. If you come in contact with a contaminated sample, you may be at risk for getting bloodborne pathogens. So again, we seal our biohazardous waste containers when we're done with our samples. They're handled in a specific way. We seal our sample containers. Every blood vial is sealed, and it's placed into a sealed holder a lot of times for transport. Again, we use hand hygiene before and after handling samples, after taking our gloves off, and we use standard precautions. Look, some of the things that can be reservoirs for infectious agents, obviously humans. Germs like damp, dark places, and humans have lots of damp, dark places. Animals, insects, fomites. If you don't know what a fomite is, look it up. We'll get the answers in lab. And blood and body fluids are also good reservoirs for infectious agents. So standard precautions include the following: using personal protective equipment, following all the safety measures, inpatient care areas, observing any isolation procedures. We'll talk about that on the next slide. Hand sanitizing before and after patient contact. Remember that patients can get things from you and you can get things from patients. So we want to minimize that. Our patients are already in a compromised state. We don't want to add to their burden. Other things that are standard precautions are needle safety devices, biohazard and sharps disposal, and disposal of all medical waste appropriately, and then decontamination of surfaces using proper wipes or bleach solution for a set amount of time. So we need to get germs off surfaces also. So when we talk about transmission-based or standard precautions guidelines, remember that this list is not all-inclusive. Patients may be isolated sometimes before we even know what's wrong with them because we suspect certain things, and then the isolation may change depending on what we find out after they get into our facility. So when we talk about airborne precautions, this means we don't want anything to get into our respiratory tract from that patient. So a patient may have tuberculosis, measles, chickenpox, herpes, shingles, mumps, and a virus. So We will be wearing masks and or respirators. We'll use standard precautions. Sometimes with tuberculosis, or often with, always with tuberculosis, they put those patients in a negative airflow room, so the air flows out of the room instead of into the hallway when you open the door. The air goes up and out. That way, the air is always moving away from whoever's in the room. Droplet infection could be things like Neisseria when they talk about bacterial meningitis, whooping cough, strep, flu, scarlet fever. You can read that whole list. And again, we want to wear a mask because we don't want those droplets in, and we'll use standard precautions, which are gloves, gown, and goggles. The protective equipment has to be appropriate for the job at hand. Contact isolation, a lot of these come into play with the draining wounds, with people with Clostridium difficile, which causes a diarrhea, herpes simplex, impetigo. If you don't know what impetigo is, look it up. RSV, herpes zoster, which causes shingles. Well, again, we use standard precautions, including glove, gown, and gloves. So prevention guidelines, wear appropriate PPEs. You have to wear gloves when you collect blood samples. OSHA says so and the CDC says so. You must change your gloves and wash your hands in between patients. Gloves, because you wear gloves does not mean that you don't need to wash your hands. So if you're drawing in an outpatient setting and you wear gloves for the next patient, you still have to hand sanitize in between the two. Gowns or lab coats are recommended. A lot of places people wear scrubs. You need to follow your facility's dress code. We like the knitted cuffs so we can pull gloves over the cuffs, and we'll learn how to do all this in lab. If you think there may be splashes to the mucous membranes, eyes, nose, and mouth, then you need to wear masks, goggles, and face shields. Biohazardous materials, excuse me, my nose is itchy, speaking of sneezing. Dispose of biohazardous materials in designated containers. What's a biohazardous material? Anything that contains blood or body fluids and is considered biohazardous material. So we'll talk about the gauze that we use to draw blood. If you can if you squeeze a gauze or a Band-Aid and blood could possibly drip out of it, then it's biohazardous and it needs to go in the container. Sharps go in puncture resistant containers, okay? And by puncture resistant, I don't mean a milk jug, I mean a certified puncture resistant leak proof container. So even if you go to draw a patient and you don't get any blood out, that's still considered a contaminated needle and has to be placed in the biohazard container. All needles are to have safety devices activated prior to placing in the biohazard container or as soon as they're withdrawn from the arm. And they still go in the container. We never ever recap needles. Excuse me. We never recap needles, ever. We never activate safety devices using both hands, so it has to be a one-handed needle safety device. We always maintain our immunizations as required by our employer. Usually this means annual flu vaccines, and most employers now require that you have hepatitis B vaccinated series. We always decontaminate our work areas with either a 1 to 10 bleach solution made daily or used with commercial wipes. You have to know your decontamination solution. Sometimes it requires 3 minutes of contact, but make sure you know how long that surface is to remain wet. We always cap our tubes, make sure the tubes are capped when we put them in the centrifuge, and we never ever eat, drink, smoke, apply cosmetics, insert contact lens in the work areas. The best rule is just keep your hands away from your face. Don't eat or drink in the lab. There have been cases where things can be splashed into a cup or people grab the wrong thing to drink. It sounds silly, but it has happened in labs. And so we just keep our hands away from our face. Remember that the lab is considered a biohazardous area. Excuse me. When we talk about bloodborne pathogens, they are infectious microorganisms in blood that can cause disease in humans. So it may include things like hepatitis B, hepatitis C, HIV. Anything that can be carried in the blood. These are the 3 main ones, but there are others. Anytime a person gets a needle stick or a sharp related injury, say that a tube breaks and cuts a hand or something, workers can be exposed to blood-borne pathogens. So we want to prevent these illnesses, and that's why we have these guidelines. And we follow them every time we collect a blood sample. So when we talk about, you can read this poster, when we talk about the CDC and standard precautions, the theory behind that is assume that every patient is potentially infected or has an organism that could be transmitted in the healthcare setting. So if we treat all samples as if they are contaminated, we will develop a set of skills that will keep us safe. So we treat everything as if it's contaminated. We don't look at the patient's diagnosis. We don't treat any samples differently. We go according to what the fact that it is a biohazardous sample because it is blood or any other body fluid. Our best defense is hand washing and personal protective equipment. And if for some reason you get exposed, a needle stick or an exposure is also a splash to your face, to your mucous membranes, your eyes, your nose, your mouth, or to a break in the skin. If you get blood on your arm, if you for some reason open a tube and the blood spills on your arm and you have broken skin, that's considered a potential exposure. You have to report that, and you have to follow your facility's guidelines to follow up on that. So be sure you read the standard precautions for infection control. You need to know what's on this poster and you need to follow it. So if there's an exposure, someone in your facility will determine if it's a significant exposure. So again, significant exposures, splash to eyes, mouth, mucous membranes, splash of blood or body fluids to a break in the skin, a needle stick, a lancet stick with a dirty needle is all a significant exposure. So you may have to have post-exposure prophylaxis, which means you may have to have medicine given. An exposure can also be if you're around someone with bacterial meningitis that's diagnosed after you've drawn their blood, you may be required to take antibiotics because that's very easily obtained as an infectious agent. So you may also have to take medicine if the risk to receiving HIV is high or the source is HIV positive. When someone is exposed, we test the patient as quickly as possible because if medications are to be given, we want to do it within 24 hours of the time of exposure. So never delay reporting an exposure. If you stick yourself with a dirty needle, you need to report it immediately. If you stick yourself even with a clean needle, it needs to be reported because it's a workplace injury. So what you'll need to do for post-exposure is you'll follow the procedure in your facility, but you'll draw a baseline sample from the employee and you will be tested for hepatitis B, hepatitis C, and HIV immediately. If you know the source of the patient and you have a blood sample, or if not, collect it, and you'll be tested for hepatitis B, hepatitis C, and HIV to the patient. All that testing needs to be done within 24 hours, and if the HIV is positive on the patient, you'll be counseled about receiving medication. If the patient was hepatitis B positive, we're going to go back and verify that your immunization is up to date, and you may receive an extra injection of immune globulin. So OSHA talks about exposure and compliance. OSHA, remember, is the Occupational Safety and Health Agency. So they updated their standards in 2001. They say that every lab has to have an exposure control plan. We have to make sure that our employees have hepatitis B vaccine and that we're using standard precautions. We have to talk about engineering and work practice controls, personal protective equipment, housekeeping, and labeling. When we talk about engineering and work practice controls, those are things like the automatic safety recaps on the needles. They're things like sharps containers, all that sort of stuff. Work practice controls are things like hand washing, using PPE. So OSHA also tells us what we have to do if the exposure incident occurs, and that it must include the following. healthcare facilities have to tell their workers which jobs are subjected to potential exposure. They have to tell the measures that the organization has taken to minimize the risk of exposure and outline a plan of to what happens if an exposure does occur and what actions need to take place. So again, OSHA requires us to use preventive measures. Most hospitals will say you need to get the hepatitis B vaccine, and it is mandatory for laboratory workers. Also, standard precautions is a preventative measure. We assume everything's contaminated and treat it that way. We also have to use measures of control, engineering controls, self closing or sheathing needles that have a protective device that goes over the top when we're done using them, sharps disposal containers, biological safety cabinets. We actually do microbiology under a hood so that it minimizes the exposure of germs. Hand washing facilities. Those are all outlined in the OSHA standards. Other methods of control are work practice controls. These are things that you do in performing your task or performing your work that can keep you safe. So, no drinking, eating, smoking, applying cosmetics, storing food, or other things in the lab, okay? And then the third and final method is personal protective equipment. The other thing with work practice control is hand hygiene. That should be listed up there. That is the most important thing also that you can do. Okay, PPE, personal protective equipment. You have to use appropriate equipment. You can't take your lab coats home. They have to be laundered in the hospital. All PPE must be removed before you leave that work area. Lab coats have to be fluid resistant. You should be able to dump water on them and they should run off. Eye protection must be worn, which means if you don't wear glasses, then you need to wear safety glasses. Gloves must be made available and worn when applicable. And then if you anticipate that you're going to be working with an area or something that has a likelihood of a splash, you need to wear full face shields. So if you're working in an area, say that you're, I can't think of an example right now. The surgical staff most likely wears full face shields. If you're working with chemicals that may splash you, you need to wear the full face shield, etc. Okay, professional practice. This is what you do. It's a combination of applying the standards in accordance with your education and training according to the job that you are doing. So this means that you know the standards, you know when you wear your PPE, you know which piece of equipment to use for which job. All of the regulations and guidelines are implemented to keep you safe and your patients safe. It also sets a standard for getting the best sample, and you won't always be successful 100% of the time. In fact, I know of 0 lab techs that have been working for any amount of time and haven't had at least one needle stick if they're phlebotomists. But if you apply them and do your best to apply safe work practices, you'll keep yourself and your patients safe from accidental needle sticks or hospital-acquired infections. So to summarize, we talked about safety precautions and infection control related to blood collection. We talked about the difference between engineering controls and work practice controls and personal protective equipment. We talked about healthcare acquired infections. There was a lot of definitions there. We talked about the chain of infection, and we talked about methods used to break the chain of infection.